I am Michelle Jane Sevilla from BSN 111. Today, I am going to perform a parenteral drug administration return demonstration using the subcutaneous and intramuscular injection. So prior to the conduct of the procedure, the first thing to do is to check the doctor's order on the patient's medication administration record, which is done to identify what kind of drug will be given to the assigned patient, to identify the drug's name, its dosage, route of administration, and time it is to be given. We also need to follow the 3 checks for administering medication. Read the label on the medication first when it is taken from the medication cart, second before withdrawing the medication, and third after withdrawing the medication. To prepare the medications, we need to have syringes. So I have an insulin syringe for subcutaneous injection and 23-gauge syringe for intramuscular injection. So I also have aspirating needles, which is used to draw medication from vial and ampule. So we have sterile water, will serve as the medication vial used in this demonstration. Of course, we also have a medication ampule, and I have a gauze pad, alcohol prep pad, cotton balls, medication trays, and most importantly, waste receptacles to dispose of used needles and syringes to avoid needle prick injuries. Now for subcutaneous injection, we will be preparing medication from a vial. First, we'll have to read the doctor's order and compare the medication in hand. After gathering the equipment needed, I'll perform hand hygiene to deter the spread of microorganisms and avoid cross-contamination. Now for subcutaneous injection, we will be preparing medication from a vial. First, we have to read the doctor's order and compare the medication in hand. Now to prepare medication for subcutaneous injection, we need to open the insulin syringe and take it out. So remember to only touch the barrel and the plunger of the syringe to avoid contaminating the needle. So if the syringe is packed, remove the top first because we'll have to connect the insulin syringe into the aspirating needle. Then open the package of the vial access device or aspirating needle and connect the barrel of the insulin syringe to the aspirating needle. So secure and ensure the connection isn't loose. So set it aside and then open the medication vial. So now that the rubber seal of the vial is exposed, clean the surface of the rubber seal using the alcohol prep pad and do this for at least 30 seconds. Take and uncup the syringe and draw air into the syringe, drawing air just with the exact amount of the medication ordered by the doctor. Then inject the air into the vial, invert the vial, and draw the medication up to the exact amount needed. So if there is an air bubble inside the syringe, tap the barrel. Now we remove the aspirating needle and replace it with the right size needle that will be used in the actual administration of the medication. Now we have discarded the aspirating needle used into the waste receptacle to avoid needle prick injury. So also write the medication ticket, name of the drug and dosage so that we won't forget what medication was drawn into the syringe and you won't get confused. now for intramuscular injection, we will be preparing medication from an ampule. So I'll just perform hand hygiene first to deter the spread of microorganisms and avoid cross-contamination. First, we'll have to read the doctor's order and the MAR and compare the label on the ampule to make sure that it is the right medication being prepared. So now, prepare the medication ampule for drug withdrawal. So inspect it and make sure it has no crack. So next, I'm going to lightly flick the upper stem of the ampule several times with the fingernail. So take the alcohol prep pad and clean the neck of the ampule to help prevent contamination and let it dry. Now we'll get the syringe and replace it with an aspirating needle. So now it's time to break open the ampule. So take the clean gauze around and wrap it around the head or neck of the ampule. So break off the top by bending it away from our body and away from others. So dispose the broken piece of the head and neck to the sharps container as well as your gauze. So now we're going to withdraw the medication from the ampule. So this time we don't have to inject air inside the ampule. So make sure that the ampule is on a steady flat surface using your fingers to hold it. So we're going in and withdraw the prescribed amount of solution. So the doctor ordered 1 cc of medication. So now remove and turn the syringe upright and flick it to get the air bubbles up. So push up the plunger slightly to the prescribed amount, remove the aspirating needle and dispose of it to the sharps container. So now that we have connected the syringe to its original administration device and we have tightened the cup, so we have also placed it on the medication tray until ready to administer the medication. Now write the medication ticket, name of the drug, and dosage so that we won't forget that, what medication was drawn into that syringe and we won't get confused. After that, place it on the medication cart. So the first procedure that I'm about to perform is a subcutaneous injection. So it is the introduction of a small amount of solution by means of syringe and needle into the adipose tissue beneath the skin. So first, check the doctor's order for the patient's chart. So good morning, ma'am. I am Michelle Jane Sevilla, your student nurse for today. So before we start, can you please state your name and your birthday, please?
My name is Ampule.
Okay, so today I'll be administering your medication today that is through your parental lobe. So will that be alright? So I'll be closing the curtains for your privacy. And I have already prepared your medication earlier. So now I'll start administering through your subcutaneous injection. So I'll be injecting insulin in this part of your abdomen. So insulin is to control your blood sugar since your you have type 1 diabetes, is that okay? So now I'll just perform hand hygiene. Now assess the client to a position in which the arm, leg, or abdomen can be relaxed, depending on the side to be used. So best side could be the outer aspect of the upper arm, abdomen just below the costal margin to the iliac crest, and the anterior aspect of the upper thigh. So now let's expose the potential injection site. So check the area for any bruising, inflammation, or edema. So palpate the site and avoid areas that are tender. So are you feeling any pain in this area now?
No.
So can you please relax your abdomen for me?
Okay.
Okay, so now apply clean gloves. So now clean the site using an antiseptic swab in a circular motion. So now pull the needle, cup and hold the syringe in your dominant hand by holding it between your thumb and fingers. So using the non-dominant hand, pinch or spread the skin at the site. So now we're going to insert the needle quickly and firmly at a 45 to 90 degree angle using the dominant hand. So pain is minimized by inserting the needle without hesitation. So when the needle is inserted, rest the non-dominant hand to the barrel and move the dominant hand and to the end of the plunger and slowly inject the medication over several seconds while holding it steadily. So quickly withdraw the needle, place a swab on the side or apply gentle pressure but don't massage the area. So if bleeding occurs, apply pressure to the site with the dry sterile gauze. So now assist the patient into a comfortable position. So flip down the medication tickets. And now remove gloves and dispose of used items and appropriate waste receptacles to avoid needle prick injury. Now perform hand hygiene. And document the procedure including medication given, dosage, time, route, and any assessment. Now assess the effectiveness of the medication at the time it is expected to act and document the results again. So the last procedure is the intramuscular injection. So it is the introduction of medication deep into the muscle tissue wherein a large network of blood vessels can absorb it readily and quickly. So before anything, check the doctor's order for the patient's chart. So good morning, ma'am. I am Michelle Jane Sevilla, your student nurse for today. And before we start, can you please state your name and your birthday?
My name is September 26,
Okay, so today I will administer an intramuscular injection. So your doctor has prescribed you with morphine sulfate to alleviate your feeling of pain, okay? So now select appropriate site for injection. So vastus lateralis and deltoid muscle are possible sites for intramuscular injection. So examine the integrity and amount of patient's muscle mass and palpate the muscle area. So if there are tenderness, then it is not the suitable site for injection. So inspect areas for bruising, inflammation, and edema. So use other sites if present. To now assist the client to a comfortable sitting position that will accommodate the injection site chosen and expose only a portion of the body. So now my patient is in sitting position. So now I will perform hand hygiene. After that, I will apply gloves. And now I will use anatomic landmarks to find the sites again. So for deltoid injection, the first landmark is the acromion process. And you're gonna go about 2 fingers width down from that area. So here is the acromial process. So we're gonna go 2 inch down. So once we have the area, disinfect the injection site in a circular motion. Now hold the cotton swab between the 3rd and 4th finger of the non-dominant hand. And then uncap the syringe and move it between the thumb and forefinger of the dominant hand. So now prepare the syringe for injection. So to give the injection, what we need to do is we're going to use the Z-trap technique. So what this technique does is, number 1, it decreases pain for the patient, but it helps prevent the solution that we're instilling from actually going in that subcutaneous tissue. So injecting quickly causes the patient less pain. So we want to steady our syringe by holding it steady with our thumb and forefinger. Now aspirate the syringe by pulling back the plunger with our dominant hand to determine if you have hit a blood vessel. So inject the medication slowly, about 10 seconds per ml, and wait for another 10 seconds to let all that fluid go down into that muscle. Then smoothly withdraw the needle the same angle we have inserted it. So now place a gauze or swab over the injection site, applying gentle pressure but not massaging the area. If bleeding occurs, apply pressure with the dry sterile gauze until it stops. So this time, discard the uncuffed needle and attach syringe into the proper receptacle. After that, remove and discard gloves and perform hand hygiene. Now place the patient in a comfortable position. So document the procedure, including the time of administration, drug name, dose, route, and the client's reaction. And assess the effectiveness of the medication at the time it is expected to act. So ma'am, we are now done with the intramuscular injection. So I'm going to cut off now so you can take rest here. So please avoid massaging the area that I have injected with the medicine. So thank you for your cooperation. That's it for the Parenteral Medication Administration. Thank you.